Hi, my name is April Jones, and I'm going to be speaking about how do we get better mental health care. After all the tragedies we've had over the past several years, there's been Sandy Hook, Virginia Tech massacre, Columbine, the Murrah Federal bombing, and Boston Race. Of course, not all these shooters and bombers had mental illnesses. Some of them were just evil people. And just because someone has a mental illness does not make them a bad person. But what if these perpetrators' illnesses had been caught at an early age? Would these tragedies have even happened? If they gotten help sooner, it makes me wonder. So, what is a mental illness? Mental illness is something that disrupts a person's thinking, feelings, mood, and ability to relate to others and the daily ins and outs of life. Mental illness can affect anyone, any race, religion, and income bracket, and it's not a result of a personal weakness or lack of character and upbringing. Serious mental illnesses include major depression, schizophrenia, bipolar, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and borderline personality. Mental illnesses are treatable. Recovery is different for everyone. Once someone comes in for help, they can receive a treatment plan, and they can find out what their stressors are. And they have to remember that recovery is a process, not an event. According to the National Alliance of Mental Illness, 1 in 4 adult Americans, which is nearly 61 million of the population, experience a mental health disorder in any given year. Fewer than 1/3 of these adults and only 1/2 of the children with a diagnosable mental disorder actually receive health services. Individuals living with a serious mental illness have a higher risk of other chronic health conditions, and they also have a shorter lifespan by 25 years. According to the Substance Abuse and Mental Health Services Administration, 45.6 million Americans, which is almost 20% of the population, suffer from some kind of mental illness in 2011. Of these, some 11.5 million, which is almost 5% of the population, suffer from a serious mental illness. So here's where the problem lies. This is according to SAMHSA data. Only 4 out of 10 people seek treatment for their mental illness. When asked why, fully half said they could not afford it, and another 15% said insurance doesn't cover mental health, or did not cover enough despite the Mental Health Parity and Addiction Equity Act of 2008, which requires insurance to provide equal levels of coverage for mental illness and other forms of disease. Most private health plans traditionally either did not cover mental health services of any kind, or they imposed a large deductible for services, $2,000 or more in some cases, which makes it hard for very poor people. Various states enacted their own laws requiring health insurers to at least offer some forms of mental health care as part of their insurance offerings. These range from simple therapy services to addiction counseling to treatments for more serious mental disease. As of 2010, however, only 22 states had any laws requiring insurers to offer mental health care. Of those, 18 require insurers to cover mental health. The other 4 only require insurers to offer such coverage. 9 of those states limit their requirements to biologically based mental illnesses and or severe mental illnesses, which typically include conditions such as major depressive disorder, schizophrenia, and bipolar disorder. In 10 states, the minimum levels of coverage are specified. All other states have no laws mandating mental health coverage and are not required to enact any. The states that require coverage are the ones that require parity, which is insurers must provide at least as much coverage for mental health care as they do for physical health care. In this regard, 14 states require parity. By 2005, there was 113 billion spent on mental health care, and SAMHSA reports that 30.4 billion were picked up by private insurance. The private insurance sector portion of the mental health tab begins to diminish comparatively. In 2005, private healthcare insurance spending, which is all 690 billion of it, accounted for a little more than 37% of all healthcare spending for that year. The rest of the bill is mostly picked up by different government programs like Medicaid. In that same year, the 30.4 billion spent by private insurers on mental health accounted for only 26.9% of the total mental health care bill. Put in another way, of all the private health insurance spending in 2005, only 4.4% of it was for mental health care. A 2012 paper by the American Psychiatric Association estimated the average inpatient cost per day for schizophrenia, bipolar, and depression ranged from $700 to $900 for the privately uninsured. and it tends to be a little cheaper for Medicaid patients. The average stay runs between 4 and 7 days, which is $800 a day stay for 7 days, and it's a $5,600 inpatient expense. According to the figures from BMC Psychiatry, the average cost for antipsychotic medication range between $5,000 and $8,000 a year, and it's rising close to 7% each year, and many patients are on more than one prescription. According to figures released by the National Alliance on Mental Illness, Virginia cut its mental health care budget by 8.9%, which is $37 million from 2009 to 2012. 28 states have also cut their mental health care services since 2009, mostly cutting inpatient hospitalization services. Of those states that have not cut spending, all but 6 have increased their spending by only single digits. Speaking of Virginia, there's a case of a senator by the name of Craig Eads. He had a 24-year-old son named Austin. He stabbed his dad multiple times in the head and upper body and then shot himself. Deeds luckily escaped and spent a few days recovering in the hospital. Austin was charged with underage possession of alcohol in 2009, though those charges were later dropped. According to the Richmond Times-Dispatch, the day before the stabbing, Austin was evaluated at the Bath Community Hospital under an emergency custody order that allowed him to be held for as long as 4 hours to determine whether he should be kept longer, up to 48 hours, under a temporary detention order. However, a lack of psychiatric beds meant that none could be found for Austin anywhere in Western Virginia, and he was released. Hours later, he stabbed his father and killed himself. The event shocked Virginia and became a national story, especially because of Austin's mental health evaluation and the failure to hold him not because he was deemed well, but because there was insufficient public resources in which to treat him. More than 90% of those who die by suicide had one or more mental disorders. There were quite a few problems with the mental health care. My mom has worked at a mental health care facility for 15 years and knows firsthand. There's a high turnover of case management because of heavy caseloads, and there's a lack of staff to cover the patient load. There's also a lack of facilities. Also, police officers should be trained in recognizing and dealing with mental illnesses better. That's another problem. My ex-husband, when I was wanting to talk about getting a divorce, he had a gun. I hid his gun from him. Well, he found his gun, and he said he was going to shoot himself. So I ran outside, and I called the police. He got into his car and sped away, and luckily the police were able to catch him pretty fast, and all they did was take his gun from him, which is not registered to him. He just found it from somebody off the street. He bought it illegally, and he's actually not even able to own a gun because prior history record. And I was wanting him to be taken into a hospital or something because he said he was going to kill himself. But he told the cops that he was okay and he wasn't going to harm himself. So they let him stay. And they also couldn't kick him out of my house because he was technically a resident, and there were some laws based on that. So he had to stay. So I ended up leaving, and I found out the next day he cut himself pretty deeply on his wrist. And then after we finally got him out of the house, a few weeks later, he burned my mom's house. So if he had been taken maybe to a mental health care facility, maybe none of this would have happened if they would have recognized that he was really, something was wrong with him. So these are just some of the problems, and they can't all be fixed in one go, but over time, if we focus on them one at a time, maybe it can be done. But first, we have to start in schools. Mental illnesses have to be caught as early as possible in the middle and high school range. We need to urge Congress to co-sponsor Mental Health in Schools Act, which is the House Bill 628 and Senate Bill 195. It's critically important legislation that provides federal funding to increase the availability of comprehensive school-based mental health services and support to build effective links between schools and community mental health systems. This legislation improves early identification of mental illnesses by funding school and community-based mental health services and linking students with effective services and support so they have a chance to thrive and reach their full potential. This legislation promises to give youth the future they deserve. The Obama administration says they will continue to look for steps they can take to prevent mental health problems and make sure people experience mental health and make sure people who are experiencing mental health problems get the help they need. The Vice President said in December, the fact that less than half of children and adults with diagnosable mental health problems receive the treatment they need is unacceptable. The President and I have made a priority to do everything we can to make it easier to access mental health services. So I'm urging you to contact your member of Congress today to co-sponsor mental health